All right, I've got a full house, and I'm so sure that medically speaking, I am fit, I am good to go. I've got three doctors in the studios with me. I've got starting with Dr. Tefak Kenem, who is the chairman, Association of Public Health Physicians of Nigeria. Good morning, nice to have you join us.
Good morning.
All right, and I've got Dr. Matthew Ashikene, Secretary General, Epidemiological Society of Nigeria. Epidemiological Association of Nigeria. I want to say good morning, thanks for joining us.
Thank you.
And the ex-president of the National Association of Resident Doctors of Nigeria, Dr. Muhammad Ashikir, in the studios. Good morning, nice to have you join us.
Good morning.
All right, that's why I said I was so sure I'm so safe now from meningitis, and that's why we're all here. Just to start with you, let's begin. Give us your take as regards this outbreak. For me, I want to say, is it supposed to be this way, knowing fully well that this occurs nearly on an annual basis, and the fact that Nigeria is on that Sahara belt where they say it's meningitis related?
Thank you very much, Mamadou. My take on the current outbreak of meningitis in Nigeria is something that one will look at it with different spectacles.
Okay.
First of all, Nigeria being in the meningitis belt of Africa, which stretches from the west, Senegal, Gambia, Guinea-Bissau, down to the east, Eritrea and Ethiopia, Nigeria inclusive, especially the northern part of the country. I think it shouldn't have taken us by surprise that we're having this epidemic, because it is already well known that after like 6, 12, 10 years, these epidemics will keep on coming. But the only peculiarities with this current outbreak is the fact that in Nigeria, unlike the Americans and Europe, we are actually in Africa predominantly been focused and been bedeviled by the Neisseria meningitis serotype A. And this is the serotype that is predominantly been affecting our region in Africa and Asia. But this time around, the meningitis serotype C is the first time we are having such an epidemic in this country. And truly speaking, there are a lot of lessons to learn from that. One is that, the Neisseria meningitis being, a bacterial infection that is highly contagious and only has a human reservoir in the nasopharynx, there is a need for us to learn something from there, that out of the serotypes, about 13 serotypes of the meningococca, the ones that comes with epidemics, commonly the A I said, B, C, Y, W. The fact is that we should learn that it is not only the ones that we are commonly peculiar with that can come in this proportion. So we should learn a lesson that the others that are not also commonly predominant here, like the B type, can also come up some other time. So the only peculiarities this time around is the fact that we are now occupied by a new strain, a serotype that we were not used to. We can say that fortunately the WHO over the time between 1996 till date, when we've been having this outbreak, there has been a positive response through vaccination using the serotype A. That is why it is predominantly controlled, the serotype A. But this serotype C, it is actually a new thing for us here in this part of the world.
Okay, yes. Dr. Tefa, being someone in the public, health, they say as much as 2,997 suspected cases have been recorded, according to NCDC. How has it been for the public physicians battling this?
Well, the whole idea of this epidemic is the fact that it took us unaware, but it's expected I would have predicted it.
Okay.
But at the moment, there are a lot of efforts put on ground to see that the epidemic is controlled. Basically, there are three ways to control an epidemic. First is vaccination, which usually happen because it could be predicted and individuals could be vaccinated. Now, in this instance, over the years, the vaccination that has been given has been for serotype A. Now, unfortunately, what happens is that in communities, people develop what we call herd immunity. Herd immunity is immunity in the community that majority of people protect themselves over time. Now, because there was no herd immunity developed for this particular serotype, individuals became very susceptible when it happened. The second approach to controlling epidemics is the environmental control, where people look at hygiene issues, people look at hand washing, people look at things that will prevent the spread of the disease, like sleeping in well-ventilated homes and then avoiding overcrowding environment. And the other component is the fact of early diagnosis and treatment. So most of these efforts are being put on ground by government, partners and institutions to address it, and public health physicians in various states have been involved in this response.
Okay, Dr. Ashikeni, your sector of health this is where you thrive most. The fact that we had the news that there was shortage of vaccine, and the fact that they said this type C strain worldwide, the vaccine is not available. How true is that, first of all? I would like to know.
Yes,
is it just that the health sector in Nigeria is trying to cover its lapses by saying that vaccine is not readily available?
No. I don't think that is the case.
All right.
When things like this happen, it's better to come out with the truth.
All right.
And be factual so that you can meet up with the challenges. Because the world is generally prepared for type A.
Okay.
We have more vaccines available for type A, and Nigeria inclusive. This type C is not commonly causing infection, and you don't produce what you don't normally use much. So as it is, efforts are being made to bring a lot of vaccines for type C that will specifically prevent new infections by type C. You are aware of the efforts being made to bring already about 500,000 doses, and another 800,000 plus is expected. And it's believed that as soon as these vaccines are available, as many people as possible will be vaccinated, so that they can also be afforded the prevention against this infection. Of course, there are other measures that are being taken on aggressively, educating the populace to know the different signs and symptoms of this disease, so that you don't stay at home. This is not a time for you to start experimenting with the chemist, all right, or self-medicating. You have to seek medical attention so that it is properly diagnosed on time. And there are antibiotics that are specific and very good and responsive to this organism. So once it is diagnosed early and these antibiotics are commenced on time, people get well. But if you delay, then of course complications and even death can occur.
Thank God you raised the issue of delay. How soon do you think these vaccines are going to arrive in the country, and what is likely to be the effect if we have a delay in the arrival of these vaccines?
Well, the federal government is very proactive about this. Already, like I said, 500,000 is on ground, already being pushed to the northwest, and where we have the epicenter of this epidemic, and then other countries in the north. By next week, hopefully, the government is expecting delivery of the 803,000 plus doses. So this will cover at least a good part of the affected states. But going beyond that, I think efforts should be made to also expand this coverage to other parts of the country. Today, it was reported that suspected cases have been found in Cross Rivers. So it's important that...
how worrisome is that the spread, the epidemic is hitting...
of course, people travel a lot. It's very easy to move from one...
Would you suggest that there should be some slight bit of restriction of movement? Would that help?
It's difficult to do that at this era, this jet age.
But it would have helped.
And well, epidemiologically speaking, it will not help for this disease. It's spread by aerosol. So how can you contain? Even here, we are all at risk. So it's difficult. What will not pay, you don't do. What is important is vaccinating the people, educating them to ensure that they don't stay in crowded places. And when you begin to have a fever, a headache, neck stiffness, or even sensitivity to light, you seek proper attention so that it is diagnosed early, and clinicians should be on the lookout for this so that when it is done, you find this, you must try to diagnose this specifically. A lumbar puncture, simple specimen collection from the of the CSF, and analyzing that in the lab will give us specifics and be able to identify the causative agent, and or even typing them and see what strains are causing this epidemic in our country. And this will go a long way in ensuring that this epidemic is contained as soon as possible. The deaths are unfortunate. They are not what we want at this particular time. And we pray that the epidemic will be contained very soon.
All right.
And the efforts being put should see that done.
Happens.
Yeah.
Okay. All right. Looking at, we've had out of the 300 and plus people that have died, children between the age of 5 to 14 have been affected. For you, what should be done to protect the children from that age group for now?
Actually, when you look at it, the risks for developing this type of diseases, especially in epidemics like this, there is age and extreme of age, especially children.
Okay. Are they higher at risk?
They are at higher risks. Okay. Children are at higher risks, and those with low immunity. Okay. And to be candid, when you look at it critically, this speaks a lot about the focus of our government to health. Because if you look at it generally, you look at it that we have 3 tiers of health, or degrees or stages of health care or providing in Nigeria. You'll see the primary, the secondary, and the tertiary. You'll see most of the energy, it is concentrated at the tertiary. The primary health care, it is, to be candid, neglected in this country.
Even with the National Primary Health Care Development
The National
Agency?
Primary Health Care Agency, actually it is an agency of federal government, and it's doing its own part. The truth is, when you're looking at, and you are talking about primary health care, this should be within the purview of the state government and the local government. When you go to the state government and the local government, you'll find out that the states and the local government pay little or no attention to healthcare generally. Most of the primary health care attention is even given by the federal government. The federal government is supposed to have been concentrating primarily on the tertiary level of care. But the truth is, the federal government is now overburdened with even the primary and the secondary level of care. And the state government, they are busy not doing exactly what they are supposed to do as far as the primary health care is concerned. And the primary health care is where you have preventive, care, and you have health promotion, health education, where you are close to the grassroots. And in that grassroots is where you find the people in the rural areas, and that is where you find the women, the children. Exactly. And that is where you can institute preventive care. And the best way of care, as he rightly said, is about educating the populace, educating the people. Let them know and develop a positive health-seeking behavior. Let them understand the importance of environmental hygiene, interpersonal hygiene. And let us understand the need for what? Preventive medicine, like what? Immunization. Immunization, when we talk about immunization, we're talking about not only in case of epidemics like this. There are vaccine preventable diseases for killer diseases that kill a lot of our children. And attention has not been, it's only the primary healthcare development agency that is really doing most. But when you look at the state government, the local government, the effort by the state and the local government is dismal. When you look at it generally. The truth is, we have to now develop a way through by which we can now legislate in such a way that we can now focus our attention on primary prevention of diseases that are very prevalent in our society.
All right. Okay. I would like you to hold on to your... Dr. Tufa, he raised a very, very important issue about the children in the grassroots rural areas, and you being in the public health sector, and the fact that this meningitis was hit at the northern states, Zamfara, Kebbi, Niger. Do we have enough manpower to cover those regions?
Okay, the whole idea is that when we're talking about health systems, is a whole discussion for a whole day.
Yeah, obviously.
And each time we talk about universal access, when you talk about universal access, what are you talking about? You are talking about health care being available to the individual and everybody without exclusion.
Okay.
Now the challenge, as you said before, the challenge is that we are not making a lot of efforts at the primary care level. Most of what you see at that level is what you cannot be proud about.
But not to cut you short,
Yes.
it's usually said that most times when doctors, health officers are sent to rural areas, they tend to reject going there. Because I had this thing with the Shelp program where we had I had to supervise those field workers, and there was this common issue about health personnel not wanting to go to the rural areas.
Now, when you talk about primary care, just remember that you're not only talking about the doctor.
Yes, obviously.
The health system is not just about the doctor. Now, the health system is about all cadre of workers working at that level.
Okay.
I agree that there's maldistribution of human resources for health.
All right.
No doubt about it. But in this instance, what we need is a system that caters for people and provide information for them at all times in such a way that they take responsible decisions
Okay.
that will prevent them from having such epidemics. At this moment, I want us to understand the fact that we have to separate the interventions that are going on
Okay.
from some of the discussions that are also going on so that we focus on the intervention and get this thing done once and for all. It's shocking because the stereotype of the particular virus we're talking, disease and bacteria we're talking about now, we never thought it would develop, escalate to this point in terms of epidemic.
Okay, the fact that Dr. Ashikeni, the fact that we never thought this was going to happen and now it's here with us, from your wealth of experience, what do you think, at least for the immediate period now, could be a very key way to containing this?
Yeah, this is a terrible lesson for all of us.
Okay.
We need to be prepared. In this country, we have tried to prepare for things we expect. Now we have to go beyond that and then also interact with our colleagues outside this country. The epidemic did not start in Nigeria.
Okay.
It started in our neighboring countries, and we should know that eventually it will surface here, and then be more proactive about that.
Are you referring to Niger, the issue that occurred in Niger in 2015?
Of course.
Okay.
Yeah. It started in Niger had cases, and this particular epidemic came from Niger, and we should have been more proactive when it started in Niger.
But is there a reason why the health sector didn't really see it from that point of view?
Well, there will be a lot of reasons, but I don't want to stand in proxy for anybody.
Okay.
But definitely, the truth is that we are not properly prepared for this.
Okay.
It's unfortunate, but going forward, we need to be more proactive, and then health is a global issue now. What happens in your neighbor's end can eventually land in it. Look at the Ebola thing, came from all the way from Liberia. So we need to learn lessons and properly fund health. It's a situation where we are not producing vaccines. We used to produce vaccines in this country, but now it's go to Lagos, at the Yaba.
Is there a specific reason why that production process was halted?
Of course, it boils down to funding. If the support is not health is not a cheap venture. It's expensive. But if you need to invest in the health of the people so that people will be healthy, now we are spending those funds that
ordinarily we
had invested in our vaccine production. Will have gone a long way in nipping this in the bud, and at the same time spending less and averting the deaths that have occurred. So we need to be more proactive, spend on health. Research is very important in health. And then, of course, preventive medicine is very, very critical. Like my colleague mentioned, it's been neglected. So I'm happy that a lot of proactive steps have been taken, reforms in the primary health care sector, the National Health Act, and all these that need to be implemented are still hanging on the balance. So once we prioritize health, then we begin to look at health systematically and then sustainably. And so some of these policies should be implemented as soon as possible so that we can protect Nigerians from such embarrassing situations. Yeah.
Okay, Dr. Oskiri, I would like you to just take us through. Now we just want to dwell a little bit on the symptoms and probably the way to contain this now as we wrap up, so that the viewer out there we know the true causes of this and what they should look out for and what measures should be taken as we begin to plan to wrap up.
Thank you very much. Actually, with the epidemic now at hand, the community, the society has to take responsibility in curbing the menace and the spread further. Okay. So one most important thing the community has to do is that people have to understand what are the basic signs and symptoms.
Okay.
And then the basic signs and symptoms actually for the children and older children and young adults is different. So for older children and young adults, actually it comes with a headache that is not as usual.
Okay.
Then you will have photophobia, sort of, you don't like light, you feel uncomfortable.
Okay.
And then you have neck stiffness, you have nausea, you get nauseated, vomiting, and the fever is extraordinarily high. For younger children, you find things like irritability, unconsolable cry, poor feeding, vomiting that is projectile in these younger children, and they will appear toxic. So by and large, most important thing here now with this epidemic, whenever there is this type of symptoms, when you look at fever, headache, there are constitutional symptoms that is common with other common diseases like malaria. So what we are now advocating is that we do not, as he rightly said, we don't now patronize chemists because we have headache, we have fever. What we need to do is that the community should understand that these symptoms, once they come up, we first of all visit health facilities so that we can be attended by healthcare providers that can really now make good diagnosis. And for the healthcare providers, then there is a need for high index of suspicion now. The fact that we are already confronted with this epidemic, they should have high index of suspicion that whatsoever comes with these symptoms, then one has to begin to think of the possibility of this meningitis. And then we get a way of, because the earlier we constitute and start treatment, the better the outcome. And the less or no complications will result. Once the management, the treatment is delayed, then there will be adverse complications. Then the second thing is that the community will have to understand basic ways of preventing the spread of the disease. How do you do that? It's an interpersonal hygiene. Hand washing is very important, and we should avoid unnecessary, kissing and handshaking. And when we are sneezing or coughing, we should develop a way of, tactfully disposing these secretions in such a way that it will not contaminate the society. And also, we got to now develop a way of ventilating our environment. That is facilities where we live. There should be adequate ventilation, and overcrowding, if possible. If we can possibly, avoid it, we avoid it. In the places where we cannot avoid overcrowding, we should ensure interpersonal, environmental hygiene, and adequate ventilation. Then contact tracing is very important. It's very important in the sense that whenever there is an index case, there's a need for the for contact tracing to trace the those that have contact with the persons with this type of disease. And also there are some prophylactic medication that can be given, because as I earlier told you, the organism, the bacteria, actually has only human as habitat.
Okay.
And they stay only in the nasopharynx. There are people that are normal carriers. About 5 to 10% of the population are carriers of these meningococci. So what actually happens is that we need to eradicate not only those that are infected, but even the carriers.
All right.
Thank you very much.
Okay, just to get your last words to wrap up. Physicians, I know this is going to be, do we say it's going to be feast period for you? You're going to have your hands full. What could be your advice to physicians out there as we tackle this menace?
As it is now, because we're also experiencing such shortage of vaccines, the focus is case finding. Yeah,
that's true. Looking at Zamfara, it's been said they need 3 million doses of vaccine. Are we likely to succeed in this fight?
Now, let's look at it this way. When you say vaccine, who are you vaccinating? You are not vaccinating the person who is sick. You are vaccinating the individual who's yet to be sick.
Okay.
So the vaccination is focused on the population that is not affected yet.
Okay.
Why those who are already with the disease need to be cared for? And when you care for them, you are equally preventing the spread.
Okay.
Because remember, an index case, somebody has to bring that index case to a hospital. The person who carries that index case to a hospital is also at the risk of the disease. You understand the point? So if you treat that index case, you are equally protecting the individual who is a caregiver. So the first thing, for physicians, what is happening now is that we may not have control over the factors that bring vaccine to Nigeria and get them to us. You understand the point? We may not have control, but we definitely have control over our knowledge and our ability to actually find the cases and treat them. So we need to be proactive, active case finding. So of course, what is happening now, once we hear that there is an emergency response declared for a state, what it means is that physicians and all health workers must go door to door seeking for cases, and usually they go with a tool that asks questions about whether these symptoms have been seen in a particular environment, and we call it case definition. So once there's a case definition, they seek that. And of course, he talked about the contact tracing. Yes, we also need to do that so that we find these cases and treat them. Now, for government, this is a big lesson. Why is Nigeria not producing vaccines?
Big question.
Now, if we talk about this meningitis, we're talking about meningitis bed that cut across from Ghana to Eritrea. Even if we look at it from a business perspective, if Nigeria is going to produce vaccine, if Nigeria is producing vaccine, these countries will consume this vaccine. So this is one thing that we should talk about immediately, and then we should start setting up system that we need to
sorry, Dr. Ashi Kenny, you just have 1 minute to your society. What would you be doing now going forward? What's going to be?
We have activated our members all over the country to go out and sensitize the people, educate the people, raise the awareness, and then where it's possible, be involved in this active case finding and contact tracing. We are scattered all over the country. We have members in academia.
But your challenge, I want to know, in other regions specifically, we know the challenge of the religion and,
Yes, that's what I'm saying. We have membership spread across the country. There is no corner, no part of this country we don't have epidemiologists. So they are partnered as we speak with the various government agencies so that they give the support. Just a few weeks ago, we visited the CEO of the NCDC as an association, and we made it clear that we are willing to partner, and we are doing that right now. And this is the time for all hands to be on deck to prevent all these deaths, and we are willing to do that as an association with other partners. So we need to actively do this and ensure that no deaths occur again.
All right, I want to say a big thank you to the doctors in the house, starting from Dr. Tefa Kenin, the chairman of Association of Public Health Physicians of Nigeria, and also not forgetting Dr. Matthew Ashikene, the Secretary General of Epidemiological Society of Nigeria, and the XY president of the National Association of Resident Doctors in Nigeria. I want to say,
Prince, I think it's very important for the society to understand that it is not as a result of any sin or punishment from God. It is not.
Yeah, we got Dr.
It is not.
Dr. Yari did raise that issue.
Because it's not because people commit fornication or because people are committing sin against God. That's why God sent. It's purely as a result of our lack of proper preparedness. Yeah, that's the simple truth. It's a lack of good governance.
All right, so take it to the bank. Dr. Mohammed has said that, and talking about Governor Yari, that statement was actually very, very wrong. And on that note, we want to say thank you for joining us on New Day today, one of Africa's finest breakfast show. I want to say thank you to all the doctors in the house and the entire production team for today's production. I want to say thank you very much, and have a lovely day ahead. Thank you very much, sir. Very good team.
Thank you.
Thank you.